Americans are living longer than ever, and that has a lot of seniors opting for plastic surgery procedures in order to maintain that youthful appearance. But what is the age limit, if any, for such procedures? Dr. Michael Kim is joining us now with that answer. Good morning, Dr. Kim.
Good morning.
You're seeing older and older patients coming into your office.
Yeah, our population is getting older, and so our percentage of patients having surgery older also is increasing. The 80 is the new 60, so patients are living longer, staying healthier, taking care of themselves. So we get a lot of patients who are older coming in talking about plastic surgery. And so they ask me, 75, 80, 85, am I too old to have plastic surgery? And so there have been some studies showing that the complication rate for certain procedures, there's Burt Reynolds, actually are very similar to those in their 80s versus those in their 60s. So that as long as you're healthy and have a good physical, see your internist, get medical clearance, making sure everything is good, theoretically your chances of having problems are about the same as someone younger.
I would think the elasticity of your skin decreases with age. Does that play a role in your healing or your outcome?
Well, I think the most common procedures we have patients over 80 is probably facelifts and eyelid surgery. And I think for the most part, by the time you hit about 70 or so, the elasticity goes down. But I think the difference between 70 and 80 is very similar. However, some studies show that patients who are older are a little bit less satisfied with their facelifts because you're right, the elasticity goes down, you take all the skin out, but still there's some residual. So usually you can't fully correct the things as if you were 50.
What are some of the things you should consider? Obviously, your health would be one factor, but are there limitations? And, are there ideas of realistic expectations when you go in if you're older?
I think you have to really go to a conservative plastic surgeon, someone who's looking out for you and not for the money. So making sure that you're a good candidate for whatever procedure you're talking about, whether it's a breast reduction, we get patients in their 70s, a facelift, eyelid surgery, etc. And to make sure that it's done in a very safe environment as a qualified surgical center or in the hospital where your outcome is going to be good and outpatient, making sure word of mouth that you've had friends that had done procedures too and it's very safe, because the key is safety when you're talking about older patients.
Is it better to combine procedures if you're looking to do several things or space them out to avoid complications?
Well, my philosophy is to be safe, so cut the OR time to maybe less than a couple hours. So depending on what they're looking at, I usually try to split them up and minimize my surgery to a couple hours rather than have these long, drawn-out 8 to 10 hour operations. So my answer to that is try to keep your operations a little bit on the shorter side and maybe split them up.
And obviously research the physician that you're going to. That
Absolutely.
would be key. And have realistic expectations as well.
Yes.
All right, Dr. Kim, thank you so much as always. We'll put this information for you on our website, weeknews.com. Our time right now is 8:24. You're watching Week News This Morning on WXCW.